Hello! Today we're going to be discussing a very common medication called lisinopril. We're going to talk about what it is, how it works in your body, possible side effects or negative reactions that may occur, and special information to know for different groups of people. The first thing to know is that lisinopril belongs to a class of medications called ACE inhibitors. This stands for angiotensin converting enzyme. This medication is used to treat a few different things, but mostly high blood pressure and heart failure. The first thing to know about lisinopril is something called pharmacodynamics. This is how the medication affects your body and your body's reaction to it. Lisinopril is a medicine that helps lower your blood pressure. It works by blocking a substance in your body called angiotensin 2. Normally, angiotensin 2 makes your blood vessels tighten, which can increase your blood pressure. By stopping this, lisinopril helps your blood vessels stay open and relaxed, which lowers blood pressure. When angiotensin 2 is blocked, another substance called aldosterone doesn't get released as much. Aldosterone usually helps your body hold on to salt and water, which can increase your blood pressure. So, when you have less aldosterone, your body doesn't hold on to as much salt, and that can help lower your blood pressure even more. Also, because of how lisinopril works, your body makes more of a substance called renin, which helps control blood pressure in other ways. So while lisinopril lowers blood pressure, it also can change how other things in your body work to help keep your blood pressure at a good level. The next thing about lisinopril that we're going to learn is called pharmacokinetics. What that means is what happens to the medication in your body after you take it. When you take lisinopril as a pill, food does not affect how well your body absorbs it, so you can take it with or without food. Your body will also only absorb a small amount of the medication, about 10 to 30%. So after taking the pill, it takes about 6 to 8 hours for your body to reach its highest level. It also doesn't stick to certain proteins in your blood, like some other medications do. And in people with heart failure, it doesn't spread through the body as well as it does in others. Lisinopril is different from other similar medications because it also stays in your body for a long time. It doesn't get broken down by the liver like some other medications do. And when it is removed from your body through your urine, it doesn't change or break down first. It's important to know that people with weak hearts, the body absorbs less of the medication, only about 16%, whereas in other people it can absorb up to 30%. In older people, the medication stays in the body longer, so they have higher levels of it in their blood. And if their kidneys aren't working very well, then their body will take longer to get rid of the medication. When taking a medication like lisinopril for your blood pressure, it's also important to note any possible adverse reactions, or also known as side effects or bad reactions that your body can have to it. One of the things that can happen when you're taking this medication is that your body can have higher levels of potassium. You can also develop something called a dry cough, which is persistent while taking lisinopril. Another common thing that happens is angioedema or swelling. It can cause swelling, especially around the face, lips, tongue, or throat, which can be serious. Because it's a blood pressure medication, an adverse effect that can happen with it is that it can make your blood pressure go too low, which can make you feel weak or dizzy. Dizziness and headaches may occur, and if you have kidney problems, it can cause your kidneys to have trouble working properly. These side effects are more likely to happen in people who have kidney problems, autoimmune diseases, or certain types of illnesses that affect the connective tissues in the body. The American Heart Association says that doctors should be careful when giving lisinopril to people with heart problems, especially if they have a condition where blood flow from the heart is blocked, as it could make these symptoms worse. When taking any medication, there are certain populations of people that may have special considerations. You've heard me mention people with liver problems, so let's talk about that first. If someone has liver problems, their doctor may need to change the amount of lisinopril that they are taking. The same goes for kidney problems. Lisinopril is removed from the body through kidneys. So if someone has kidney problems, their doctors may adjust the dose based on how well their kidneys are working. If their kidneys are working well, they don't need any dosage changes. If their kidneys are only working a little bit, then maybe they should start with about half the usual dose. If kidneys aren't working much at all, or if someone is on dialysis, the doctor will give a very small dose, like a starting dose of maybe 2.5 milligrams one time per day. If you are pregnant, you should definitely take considerations before taking this medication because it is not considered to be safe during pregnancy. It can harm the baby's lungs, kidneys, and bones, and it can even be fatal. Pregnant women or women who might become pregnant should not take lisinopril unless they're using birth control. For women who are breastfeeding, the doctors recommend that breastfeeding mothers do not use lisinopril because it can pass into the breast milk and it is not known how it may affect the baby. For children aged 6 years and older, the starting dose is usually based on their weight. The doctor will start with a small dose and gradually increase it until the child gets to the right amount that works for them, up to a certain limit. Thank you for hanging out with me today and learning about this commonly used medication.